Youth Anxiety Center, I think, is a model program. It's been very successful because, frankly, with regard to medicine in general, but particularly with psychiatry, we're in a better position now than we've ever been in history.
If you had another medical condition, whether your child had asthma or diabetes or something else, you'd want the best that medicine has to offer based on clinical trials and evidence and practice guidelines that say this is what's going to help your child manage this condition. That should be the same thing in mental health.
If you look at all Americans in the United States, 29% of them will have an anxiety disorder at some point in their lifetime. This is the most common group of psychiatric disorders that we have.
The level of knowledge of the population at large of what the symptoms of a mental disorder are is not nearly as well known as they are for heart disease or for cancer or for gastrointestinal disorders. So people don't necessarily know what they're suffering from, and they just, bite their lip and bear it.
If you add it all up, the chronicity, the commonness, and the symptoms that can interfere with people's lives, you can see this is a big public health issue.
At the Youth Anxiety Center, we are bringing a history of evidence-based treatments to these young adults. And when I say evidence-based, these are treatments that have been developed by ourselves and our colleagues over many years, proven in clinical trials to be effective in treating anxiety across the ages, and then developmentally tweaked in a way to address this parent-child interaction in young adulthood, and also to address specifically for young adults treatment in a social context. They need to get back in with peers, other peers who are also suffering like they, and together have the social support to get into the world.
In the past, we've always thought that these disorders magically appeared. Now we know that there's usually a prodrome and then sort of a latency period and then sort of the eruption. And now it's become clear that many of the underlying neurobiological processes are occurring even before or just before the symptoms occur. And if we can get and start treating and diagnosing our patients much earlier and at critical windows, we actually might have a much better chance.
Over time, as youth are making choices that are dictated by their anxiety, removing themselves from important developmental situations where their peers might be moving forward academically or socially, as that happens over time in adolescence and then particularly into young adulthood, those youth who've struggled with anxiety start to move off the typical developmental trajectory. They're missing out on milestones.
We need to have a new way of doing research, and this might be the future research of psychiatry, where you actually, I would call the basic science of psychiatry, where you would have basic scientists work hand in hand with clinical psychiatrists and translational researchers to try to come up with new ideas and new paradigms. If you can get a group of people to sit together who normally would not have sat at the same table and come up with new hypotheses, high-risk hypotheses, for example, of how to treat or how to diagnose anxiety disorders at a very early stage. I think this is something that has not been done previously.
If you've got basic scientists, clinical scientists, really a number of different disciplines working together, a move in one, an advance in one, gets channeled back to the other one, and has an impact, and it goes back and forth in a sense, like an ongoing discussion.
Collaborating with one another across this age range is very key to this program, and will likely lead to advances in terms of particularly targeting youth in transition, which is what we hope to do, to modify the present treatments that we have, to study novel medication treatments potentially as well. I think all of us collaborating across our different areas of expertise are going to help accelerate that process, I think, really fast.
This is a group of people that probably doesn't exist anywhere else in the country, maybe the world, where there are so many of us who all have established real expertise in our domains, who are in the same place, working together across institutions. This is Columbia and Cornell working with New York-Presbyterian.
We definitely want to keep revising our treatments, testing them, and subjecting them to very rigorous tests so that we can offer our families the best possible chance of getting well and having that young adult emerge and launch into adulthood.